Hi to everyone. Today let's see about diabetic foot assessment. Diabetic foot assessment. It is a systematic and dynamic way of collecting and analyzing the data from a diabetic patient with the purpose to treat, educate, and reinforce healthy lifestyle and to lead quality of life. There are three main etiological factors for developing diabetic foot. First one is ischemia and diabetic nephropathy and infection. So now we'll see about assessment. Assessment has got two components. One is history collection and two is physical examination. In history collection, first we need to collect the general history of the patient. In general history, we have to collect about the medication. What is the history of medication? Whether the patient is adherent to the medication, he is regular or irregular on medication. So that we have to collect. And then patient has any risk factors, cardiovascular risk factors like increased cholesterol, increased LDL, decreased HDL, triglycerides, and obesity. So that risk factors, whether the patient possesses or not, that we have to check. And what is the nature of the work, sedentary work or heavy work, and whether the patient has got alcohol and cigar smoking habits, and what kind of a lifestyle the patient has got, like regular exercise, food habits. So those things we have to collect. And along with this, they have any signs and symptoms of diabetes and its complications. Complications like we have micro and macrovascular complications and acute and chronic complications. So for this, they developed any signs and symptoms. That related history we have to collect from the patient. And then second main thing is focused assessment towards the foot specific assessment. So in that we have to ask for a risk factor, presence of risk factors like development of numbness over the foot and tingling sensation or a burning sensation. Like this, any risk factors they have developed, any change in the color of the temperature, change in the color, change in the temperature of the foot. So those things are called the risk factors, whether they have developed or not, that also we have to collect in the history. And if they have developed ulcer, means we have to ask for the duration of the ulcer development. What is the cause for the ulcer? Any nail prick or a skin injury, lesion developed, or due to a wrong size of the shoe, they developed skin trauma. So those history we have to collect. And whether they are in any treatment or not, or else some will get the treatment from the pharmacy and they will put ointment, or really they have obtained treatment for this ulcer. So these are all the main salient features related with the foot assessment, diabetic foot assessment. Next main component is the physical examination. So physical examination, before we do the physical examination, we have to prepare ourselves, patient, and environment. So for that, first wash hands and don the PPE if appropriate, and introduce yourself. It's very important. It will bring confidence from the patient, and the patient will be cooperating with us. So like we can introduce like I'm Shashikala, I'm a nurse assigned today, I'll be taking care of you. So that will give a confidence with the patients. The patients will be cooperating with that. And then second one is confirm patient with his name and date of birth. You can ask them like, what's your good name? Or can I know your name? Can I know your date of birth? So then you can confirm you are going to give care to the right patient. So that we have to do it. And then next preparation is explaining the procedure and getting the consent is legal one. So that is very important, because we are going to do an assessment. We are going to touch the patient. We are going to ask the patient to do some action. So we need to get a consent. Without their consent, we are not supposed to proceed on. And next one is the positioning the patient is very important. For this assessment, putting the patient in Fowler's, that is 45-degree angle, it is very good to give a very good visualization for both the examiner and then examinee. And then next, last but not the least, assessing the level of pain is very essential, which we don't consider much. but which is really important to identify, because if the patient has pain, the patient will not cooperate with our procedures. Moreover, the findings which we are going to obtain after the assessment will not be a correct one. With the pain, patients cannot exhibit with the right finding. So we have to, if we identify patient has pain, we have to take steps to reduce the level of pain, keep them comfortable before your procedure. It's very important. So these are all the important points we have to prepare before we go for physical examination. Physical examination, first component is inspection. So inspection, we have to observe. Inspection is nothing but observation with the help of your eyes. So visualization in the periphery, in the foot, we have to do like assess for peripheral pallor. What is peripheral pallor? A pale color of the skin that can indicate poor perfusion. Whether the pallor is there or not, that we have to check. And second one is cyanosis, bluish discolorization of the skin associated with low SpO2 saturation level. That is cyanosis. And scar is hardening of it indicates hardening of the tissue. It indicates of previous surgical intervention, like bypass surgery, vein harvest they would have done. Okay, that surgical scar will be present. Okay, so that is called the scar. And next one is the hair loss. It occurs due to the chronic impairment of tissue perfusion. Especially we can see in PVD, peripheral vascular diseases. So whether the distribution of hair is equal or it is unequal, that we have to assess. And next one is the venous guttering. Venous guttering is nothing but due to a reduced blood supply, the veins will become will be looking like it will give a guttering appearance. So that is called venous guttering. And other important findings like venous ulcer. Patient will be developing venous ulcer. And another is called in arterial ulcer. There is a difference between venous and arterial ulcer. By these clinical features we can identify. Venous ulcer typically large and shallow ulcer with irregular boundaries. And patients will have minimal pain. But in arterial ulcer, it will be very small but well-defined ulcer with severe pain the patients will be developing. That is arterial ulcer. And the patients may have gangrene. Gangrene is a tissue necrosis secondary to inadequate perfusion. So typically, the patient's skin color would have been changed. It will be dark black in color. So these things also some of the features. And some other is called like foot callus. Foot callus, it is like due to an inappropriate use of sizes of the shoes. Okay, reason for this foot callus. And also in abnormal gait is also a reason for the development of this foot callus, hardening of the tissues you can identify. And the next one is the amputated toe. Amputated toe will reveal about the previous surgical intervention due to the ischemia or the gangrene. So with that we can identify. And next one, important one is Charcot arthropathy. This is otherwise called nephropathic arthropathy. It involves the progressive degeneration of a weight-bearing joint due to peripheral neuropathy. Especially the angle joints will be progressively degenerating. Because of that, the bone density will reduce, and in long run, it may lead into bone deformity. So that is called the Charcot joint. Patient may, sometime in this condition, patient may develop effusion, distortion, erythema, and loss of joint function also. So these are all the points for the inspection. Next, we are going to see about the palpation, mainly the temperature. So place the dorsal aspect of hands onto the patient's lower limbs to check the temperature. Normally, people who have got adequate perfusion, they will have warm temperature symmetrically. That means both the limbs will be warm on touch. That is a normal finding. People with poor arterial perfusion will have like cool and pale limbs on both the limbs we can identify. This is about the temperature on palpation. Next, about the pulse. So pulse, we have to have it in your mind that whenever we check the pulse, we have to check both the limbs and we have to compare both the limbs pulse with all the characteristics. What are the characteristics? Rate, rhythm, volume, and the depth. So all these characteristics we have to assess in the both the limbs. So what are all the pulse we are going to check? In the foot assessment, there are three main pulse: posterior tibial, dorsalis pedis, popliteal pulse. So posterior tibial pulse, we can palpate at the posterior to the medial malleolus of the tibia. And then dorsalis pedis pulse, we can palpate at the dorsum of the foot, lateral to the extensor hallucis, longest tendon, second and the third cuneiform bones. Okay, and then popliteal pulse, we can identify behind the knee. So these are all the common sites to assess the pulse for the foot assessment. Next, the important one is assessing the sensation in the periphery. So for that, we have many tests. First test is called the monofilament test. So before we proceed the actual monofilament test in the foot, we have to demonstrate this either in the arm or the sternum of the patient to create or to give a knowledge about what is the test is all about. Okay, so then we have to perform it is on the foot after asking the patient to close the eyes. So where and all we have to this monofilament we have to keep first in the pulp of the hallux, the pulp of the third digit, metatarsophalangeal joint 1, 3, 5 as it's shown in the picture. These are all the points we have to keep. So how to do this procedure? Ask the patient to report when they feel the monofilament touch in the foot. Okay, first press the monofilament against the skin until it bends slightly. So thereby we can confirm it gives off 10 grams of pressure. And then it has to be hold. The monofilament has to hold the monofilament against the skin for 1 to 2 seconds. Avoid keeping the monofilament over the callus or the scar because there much of sensation may not be there. If the patient is able to identify the right place, means it shows patient has a good sensation. This is about monofilament test. Next, we have to assess for the gait of the patient. So diabetic foot disease can result in abnormal gait because of its abnormal sensation. So we have to check for speed, stance, stability, steps, and then turning. So speed, gait speed may be reduced significantly in the patients with advanced peripheral neuropathy. And stability is also, it will be difficult for the peripheral neuropathy patient. High steps we can identify with the presence of foot drop. So that also we can identify. Then turning, due to the impaired sensation and proprioception, the turning, when the patient walks and turns, when the patient takes a U-turn, the patient feels difficult and something slips. Okay, so that is due to the impairment of sensation and proprioception. So all these things will reveal whether the patient has got peripheral neuropathy or not. Next important one is assessment of the footwear. Assessment of footwear is very essential. We have to see the sole of the footwear, whether it is symmetrical or asymmetrical. Asymmetrical means it denotes abnormal gait. Patient puts weight on one foot for the long time. So that's why the sole of the footwear may be asymmetrical. And we have to check whether the footwear is in a correct size or not, because too tight and the too loose sure will injure the foot. So we have to check for the correct size and the size of the shoe. And next is the vibration sensation test. So for this vibration sensation test, we need to have a tunic fork which is of 128 Hz. So this sensation test, it involves the dorsal column of the vertebrae. So this also, like before we do the test, perform this test on the periphery in the foot, we have to do this either in the, in the sternum. We have to demonstrate. How to demonstrate? To vibrate the tunic fork, keep the tunic fork in the in the chest, and ask the patient to say when it starts and when it stops. Whether the patient is able to identify the initial starting of the vibration and ending of the vibration. So the same we have to perform after vibrating the tunic fork. keep the tunic fork in the interphalangeal joint of the patient's big toe. If the patient is able to accurately identify the vibration, when the vibration begins and when it stops, means the assessment is positive. That means the patient has good vibration sensation. If the patient is unable to identify at this site, means we should not stop. We have to continue our procedure, like vibrate and keep it in the metatarsophalangeal joint of the big toe. If the patient is unable, again we have to perform the same at the ankle joint. If the patient is unable to recognize, again we have to perform at the knee joint. We have to progressively go from below, lower to the up. First in the interphalangeal joint, if not metatarsophalangeal joint of the big toe, then ankle joint, then knee joint. Thereby we can identify till when or till where the patient has developed loss of sensation. For that, we have to do this vibration sensation test. The next test is proprioception. Proprioception means joint position sensation, sensation of the position. That is proprioception. This also involves the dorsal column. So before beginning the procedure, here also first we have to teach them what is the procedure. For that, we can ask the patient to open the eyes and we can tell them, like big toe, we have to move up and down. So whether the patient is able to say when it goes up, the patient should say yeah, up. When it goes down, the patient should say it goes down. When the real procedure starts, test assessment starts, you have to ask the patient to close the eyes, and randomly we have to 3-4 times we have to up down we have to move. Then at one moment we have to raise the great toe up and ask the patient which position the toe is. If the patient is able to recognize it is up, and when the toe is really down, the patient has to really recognize down, means patient has got positional sense. That is proprioception. So patient has got good proprioception sensation, means patient has got normal finding. So this is about the proprioception. So next assessment is ankle jerk reflex. For this we need tendon knee hammer. So to do this procedure, we can ask the patient, this reflexes will be absent. We are going to check the reflexes. So this reflex will be absent in the case of advanced peripheral neuropathy. To do this, ask the patient to sit in the couch support with their legs, so that their hip is slightly abducted, the knee is flexed, and the ankle is dorsiflexed. And then tap the Achilles tendon with the tendon hammer, knee hammer, and tendon hammer, and observe for the contraction in the gastrocnemius muscles with associated plantar flexion of the foot. If it is reflex is present, positive, it is normal. Reflex is absent, means patient has developed advanced peripheral neuropathy. So far we have seen about all the steps of assessment, how to collect history and physical examination. In physical examination, observation, that is inspection, and in palpation, temperature, pulse, and then sensation assessment, monofilament assessment, vibration testing, and then ankle reflex testing and proprioception. So all these assessment will be done for the foot assessment. Finally, once your assessment is got over, we have to explain explain to the patient that examination is completed, because until we complete the procedure, the patient will be very much anxious. So we have to tell them examination is completed, and we have to thank the patient and wash hands. If any PPE is being applied, it has to be removed and discarded in an appropriate color coding dustbin. And then afterwards, summarize and documentation of finding is essential. So with this, the assessment of foot gets over. Thank you very much. Do you want to stop loading it? If yes, you will receive an email notification when the cloud recording is ready.